she has a pleasant voice.
So this is how to set up the Lipiflow. First off, you're going to remove the cover. Make sure you don't have a pen in your hand or anything because it's a nice cover. You don't want to get stuff on it. Once again, try to fold it neatly. I'm going to put it in here. I'm going to put it up at the top there since there's nothing really there already. Probably better redo them. But anyway, so first off, you're going to turn on the machine, which is a switch in the back here. And that's where my finger is, right there. That's where the switch is. It's a little hard to see, but you'll feel it. Just a little switch there. And the machine will turn on. While it's turning on, I'm going to go ahead and pull the things that Dr. Johnson will need during the procedure, which will be, I'm trying to remember if it's light blue or liquid. I think it's not liquid. No, I think it's light blue. So I'm going to grab two lid scrubs. That's light blue. And I'll put these here on the counter. And I'm also going to grab, I believe, Lotamax for the patient after the procedure. And we're not going to attach these today, but you'll get the actual applicators out from this box here. They look like this. I'm going to go ahead and get one out, not both. I'm not going to just for demonstrating something a little bit later. So we're just going to wait for this to get ready. And I'm also going to, while this is happening, get some surgical tape and prepare some pieces. I'm not going to do it because I don't want to waste it, but you'll do it. You want at least 2 long pieces, and you also want about 2 short pieces, or 4 short pieces. There will be 2 per eye. And when you put them on the chair, you want to put them down here, because right here is where Dr. Johnson will adjust the headrest for the patient. So, how do I get that back? There we go. So you'll put them down here. I would do that, but I'm not going to waste it. So I'll put it back. And you can do this while the Lipiflow is booting up, so you're saving time. And now it says touch screen to continue, so I'll touch the screen. Username for the Lipiflow is Lipiflow. And for the Lipiscan, it's Lipiscan, because that makes it easier to remember. And I'll hit submit. So now we're here. If you wanted to search for a patient, you could by either looking through this list, or you can just search through here. I'm curious if we've ever done a test patient. Yeah, so there are test patients that have been done. I'm going to go ahead and make a new patient just for the sake of it. So I'm going to do add patient. I'll hit that afterwards, but I'm just going to do an ID, last name, test. All right, so now all that information's in there. I'll hit add patient. So now I have a new patient here. And then I'll click their name and I'll say perform treatment, view print results, or edit patient. So if you made a mistake when you entered the patient's information, you hit edit patient, but I'm gonna hit perform treatment. So now it's performing a self-test for the patient right now, not patient, for the machine. So now it says connect a disposable device. So we put everything out that we need to put. We're not going to open anything. But if you were to, what you want to do for this is, without really messing with it too much, it opens here with the little arrow pointing there. So what you want is you want the back with that green flag and the black circle to be oriented in that direction. Because when you attach these probes to there, that is going to be what is easiest for you. So I'm just picking up this clear plastic on top, and I'm letting it kind of fall. So now it's oriented pretty well in that direction. If we were actually doing the treatment, I would go ahead and take these cords, and they have a little clip on the back of the machine. You can feel them. They're just rubber, and when you put them away, you'll put it along that so that it doesn't fling everywhere. You can see here that it has a little place for the flag and a place for the black thing. So what I would do if I was doing it is I'd open it. I would, before putting it on there, I'd wipe this off with an alcohol wipe. So I'm wiping here first. Try not to get alcohol in the actual circle or in the crevice there. You'll just wipe the outside. Start wiping down here while I'm still holding the alcohol wipe. I'll hold the thing and then I'll place it, push it in there. And then we leave those in the bags for Dr. Johnson before she comes in the room. And I think that's it. And then when the patient, before they come in, you want to make sure that they have a drop of proparacaine in both eyes. That's it.